we know about this variant right now and how contagious it is?
So this one, XBB.1.16, like all the ones before them, if you dominate the field, you're the most transmissible subvariant of all. So this is still in the Omicron family, but it's more transmissible than BA4 or BA5, the ones that we have in our bivalent vaccine. Now, luckily, in the rest of the world, we have quite a bit of natural immunity and vaccination-induced immunity, but China had a really strict lockdown policy. And after protests in their country, they reopened on December 7th, 2022. And after that, there was a very unfortunate large wave of COVID mortality that happened around January, February 2023. And that's actually why the World Health Organization did not declare the end of the global health emergency until May 11th, 2023. They waited, actually May 5th was WHO. The US was May 11th, but they waited until the mortality had gone down in China and said, okay, everyone's in the same boat. We have a lot of natural immunity now. And China had pretty good rates of vaccination in the elderly. So I'm hoping, despite cases in June, that they'll have a low rate of hospitalization. We should have the immunity that they got from the January, February wave.
So we won't need an additional booster or shot to prepare for this.
No, so what happened is the FDA on April 18th, 2023, did say that anyone who is older in this country or on immunosuppressant could get an extra bivalent booster. And so that would just happen in April, and that was in anticipation of XBB.1.16 because it was already in other countries. Actually, it started showing up in India. So anyone who's older on immunosuppressant should get a bivalent booster around this time, but most people who are older are going to get their booster in fall of 2023. I don't know when we're going to see a seasonal pattern of COVID. It's been sort of crazy. It goes up and down with the variants, but hopefully someday soon it will settle into seasonality, winter season.
Okay. There's some new research, Dr. Gandhi, on kidney disease and the importance of screenings. A new study found screening everyone 35 and older for chronic kidney disease would save lives. Right now, it's estimated chronic kidney disease affects about 37 million Americans, 15% or so of U.S. adults. When were people typically screened for kidney disease?
You know, it's not actually typical unless someone has risk factors. So if you have diabetes, high blood pressure, we're doing a lot of creatinine screening. Creatinine is the blood test that tells you how your kidneys are functioning. But to do it at 35 when someone's healthy prior to the study has actually not been a feature of medical care. But I think it's a really good point. Like, it's a super simple test. It's a blood test that's very standard, and people are coming in for their medical care. And if we catch something like this early, we can use interventions that help prevent people from going to, sort of really difficult outcomes like kidney transplants.
So will it lead to new recommendations, do you think?
I think this is a large enough study that I hope so. Actually, they did something called a cost analysis, which is often really important in these type of studies. Is it worth the cost? And actually, it is worth the cost, meaning their cost-effective analysis showed really good value for something this simple. We do a lot less, meaning we'll do HIV tests on everyone, we'll do CBCs on everyone. So I personally think this is a big enough study by a really, really respected group of investigators at Stanford that with a good cost-effective analysis that will hopefully change one-time screening, just one time. Age of 35, you're coming in, you're getting all your routine things, and you for sure get a creatinine, which is a simple blood test. Yes, okay. I think it should change guidelines.
Yeah, catch it early. Finally, yes. Vitamins do a body good, right? New research from Columbia University found older people who took daily multivitamins had better memory function. Tell us about this research.
Yeah, it's the vitamin industry has gone kind of back and forth with this. I mean, a lot of people take vitamins, but they don't. We haven't had good research on it, to be really honest. And this is basically just saying taking a daily multivitamin. This does help people who are just absolutely normal but are having that normal age-related memory loss that occurs at age 60.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.